What you're looking at are the two separate strips that came out. This is a 12-inch ruler, but we base everything on centimeters. The first strip came out to about 34 centimeters. The second strip came out to about 32 centimeters. So let's say he has 200 hairs per square centimeter. We have 33 square centimeters of hair, which would yield us well over 6,500 hairs. Now what's important to notice is when we harvest the donor, what we're trying to do is we're trying to make sure that the follicles are intact. What you're seeing here, the yellow is the subcutaneous fat. Okay, the little black dots are the bulbs of the follicles. The little hair coming out of there is the follicle itself. The most important thing is to not transect those follicles.
Why is that?
Well, what happens if hairs get transected, then they get destroyed, then they won't grow. So if we keep the hairs intact, we're able to get a higher yield and we're able to get more hair for the patient. So if you look at this strip, you'll notice that there's virtually no transection. You don't see any cut hairs. The reason you don't see any cut hairs is, one, I experience and do a lot of surgery, but two, I take my time, and that's what's most important. A lot of doctors rush through this. They don't take the time to harvest the donor properly, and that's where they destroy a lot of the follicles. So when the team dissects this up, what we're going to do is we're going to dissect it up into these tiny little bundles. Okay, those bundles are follicular units. Okay, let's start off looking at this very top piece first. This is a tiny piece of tissue that we showed you earlier. That's about a ½ centimeter. Okay, so what you're looking at here with this particular piece is the yellow, once again, is the subcutaneous fat. The black dot's the bulb of the follicle, and then that little follicle is what grows out from that bulb. So when we look at it from the top, okay, let me turn this around for the camera, you can see these tiny little bundles of hair. Those little bundles are the follicular units, okay? So I'm going to show you what those look like when we harvest those out of that donor and dissect them in magnification. So when you look at it from the top, okay, you can see those bundles coming out of there. So we dissect that into one hair grafts. That's the bulb of the follicle. That's one little hair. This is another example of a one hair graft. This whole bottom row are all one hair grafts. This is what goes in the frontal hairline, and this is what creates the softness and the naturalness. Behind the one hair graft, you'll see over here, this is a follicular unit. You'll notice some of these follicular units might have 2 bulbs, and some might have 3 bulbs. So that's natural. Some people have 2 hair follicular units, some people have 3 hair follicular units, some people might even have 4 hair follicular units. So it varies from patient to patient, and it varies on the individual patient. So right now, the hair transplant industry will only use these 2 bottom rows, the 1 hair grafts and the 2 3 hair grafts, and then they'll take those and they put them throughout the entire scalp, all over the head.
And what do you do?
Well, the problem with that is it does look natural, but it doesn't yield you density. So what I do differently than everybody else is I use a graft that's called a multiple follicular unit graft. So the Bolton graft, which will have 2 or 3 of those bundles in one graft. So now when you look at it, you'll see all these little dots, 1, 2, 3, 4. If we flip this over, you can kind of see it from the other side. 5, 6, 7, 8, okay? Let's take this particular graft, and I'm going to pass it over to have it dissected. Okay, so we're going to break this into the 3 follicular units. We're going to show how we're going to take that. Okay, 1, okay, keep going. 2, 4. So the same one graft, okay, there's 1 follicular unit, there's 2 follicular units, there's 3 follicular units, there's 4 follicular units. So now we took 1 graft and we've now created, out of that 1 graft, 4 follicular units, okay? So now we're going to show you another example with that same 1 graft, what we can do to it. Now let's cut it into all singles. We had the 1 graft, okay, and now we got 1, 2, 3, 4, 5, 6, 7. We got 7 individual 1-hair grafts. You have the same product from 1-hair graft yielding you 7 hairs, or 7 individual grafts yielding you 7 hairs.
Wow.
Both of which will yield you the same amount of hair, but what the hair transplant industry neglects to tell you is they're charging you now for each individual graft, even though you're not getting more hair. The more that a graft is cut, the more of a chance that you're going to get transection of the follicle. So this was part of that graft before, because we had to cut it down.
Which you don't want.
Yeah, the more you cut it, the more you're going to lose hair, and it's going to cost the patient hair. We want to keep it as much in its naturally occurring bundles as possible. The more we can keep it the way Mother Nature meant us to keep it, the better off the patient's going to be. So the more I dissect it, the more transection, the more follicular damage, the less overall yield the patient's going to have.
Wow.
So what you're doing is you're paying more money for less hair.
Yeah.
And so that's what they neglect to tell you. And that's where the problem lies, is when they break it up like this, it does a disservice to the patient, it does a disservice to the industry, because the patient's getting less hair, they're getting less of a result, they're not happy, they're not telling their friends, they don't want to come back. It's hard to dispute it when you see it in this manner, but let's take a look at this particular graft that we just set down that broke it up. You can see those 2 or 3 bundles right on the top. Now, it's a tiny little slit graft, so it's not to be confused with the plug. It goes in a little slit graft, so the blood supply is not compromised. And basically, we're just putting it back in its own environment where it was. So envision this. We're just going to take this little graft and put it right back in. And that's it.
Like it was always there.
Just like it was always there, because it was. It's
Right.
its own hair back right where it belongs. And that's it. So that's what we're doing, and that's what we do differently than everybody else. There's a better way to do it that's out there, where we don't have to dissect the grafts into these small things for no reason. And this is how we want the industry to go, so that way the patients will be able to have less procedures, less surgery time, they're going to have a higher yield, and they're going to have a higher overall satisfaction, because they're going to be happy that they have more density.